I check the patient's orders for allergies and code status. I gather my stethoscope, the pen light, some gloves. I wash my hands, put on the gloves, and I'm going to go in the patient's room. Open the door. Come in. Close the door behind me for privacy. Good afternoon. My name is Jasmine. I'm a student nurse at FTCC. Can I get your full name and date of birth?
Alexis Smith, 8/22/1998.
Okay. Well, Miss Alexis, we have to perform a physical assessment on you today. Is that okay?
Yes.
Are you in any pain?
No.
Any allergies?
Nope.
Okay. I'm gonna put you in a comfortable position. Put the patient's in a comfortable position. I've assessed your vital signs, Miss Alexis. Your heart rate, blood pressure, temp, O2, and respirations. They're all within normal limits. Can I get your age and your gender?
Female, 21.
Okay. And your height and weight?
5'4", 170.
Okay. Any allergies?
No.
And pain?
Nope, no pain.
Okay. Do you know what day of the week it is?
Yes, today is Friday.
Okay. And do you know where you are right now?
Yes, I'm at the doctor's office.
And do you know why you're at the doctor's office?
Just to get a checkup.
Perfect. As Alexis answered my questions, I checked for relevance, content, and organization of responses. I also assessed speech for quantity, pace, volume, and clarity. During the questioning, I inspected general appearance, which she was well groomed, presented good hygiene, and great posture. I'm palpating the skull for size, shape, symmetry, masses, and scars, and inspecting the scalp for hair thickness or thinness, texture, oiliness, and evenness of growth. So I'm going to note symmetry of facial movements right now. Okay, so can you raise your eyebrows? Okay, and can you frown? Frown. Can you smile and show your teeth? Okay, and I'm just going to check the eyebrows and eyelashes for hair distribution and evenness. So now I'm going to assess your eyes. Okay, I'm going to check your sclera for any yellowing, redness. No yellow, no redness. They're nice and white. I'm going to check your pupils. So pupils are equal, round, and reactive to light. We're going to check for accommodation. So if you can look at the pen light, look past the pen light first. Okay, now focus back in on the pen light. Accommodation as well. And checking for convergence. Okay. So now we're going to inspect your nose. I'm going to look at the outside for any flaring or discharge. You're good. I'm going to look at your septum for any deviations, and I don't see any. Looking for swelling, redness, discharge, growth. It's all clear. So now we're going to assess for patency. I'm going to have you hold one side of your nose and keep your mouth closed and blow. And we'll do the same to the other side. All right, good. We're going to inspect your ears now. Do you wear any hearing aids at all?
No.
Do you have any trouble hearing during conversations?
No.
All right. I want to inspect this ear for any buildup of wax. There's no drainage or lesions in it. Come around, do the same side to this ear. Same, no buildup of wax, no drainage or lesions. Okay, Miss Alexis, we're going to inspect your mouth now, okay? I'm inspecting the lips for skin integrity, dryness, and color, as well as the gums for bleeding, color, edema, and lesions. I'll look at the tongue for color and dryness, and the hard and soft palate for color, shape, and dryness. I'll also look at the teeth for color, cavities, chipping, tooth loss, and presence of dentures. I'm inspecting the trachea for midline position, as well as the thorax for breathing pattern, rate, rhythm, and the symmetrical rise and fall of chest. I'm going to check your heart and lung sounds, okay? Here I will listen to the apical pulse for 1 full minute. I will listen to the other areas for 10 to 20 seconds each and distinguish both S1 and S2 sounds. Now I will osculate the chest using the 6 points anterior. The 8 points posterior. And the 2 points lateral. Okay, so now we're just going to palpate your chest and your back for masses, if you're breathing equally, all that good stuff. Check your trachea. Okay, you turn to me. Alright, I'm going to check your radial pulses. Make sure they're equal. Alright. And your pedals. Okay. Then, for your brachial, you would check here. Femoral, popliteal is in the back, and your tibials. Now I'm going to check your hands for peripheral perfusion. Looking for any edema, any swelling, the temperature, they're nice and warm. I'm looking at color, nice and pink. Check skin trigger. Gonna check capillary refill and at least 2 of her fingers. Alright, and then I would do the same for her toes and her feet. I would check for edema, the color, cap refill, temperature of her toes. Now we're going to check your abdomen. I'm going to palpate around and I'm going to listen for vowel sounds. Is that okay?
Yes.
Okay, so first I'm going to inspect. I'm going to lightly palpate around the abdomen, checking for any distension, any masses. I would look to see if there was any scars. I feel no masses, no distension. On here, I'm just gonna check above the pubic area for any distension. There is none. Now we're gonna listen to vowel sounds in all 4 quadrants for 10 to 15 seconds. They are all clear. For the perineal assessment, I would inspect the groin or genitalia for skin integrity, discharged lesions, and inspect the rectum for skin integrity, discharged lesions, or protrusions. I'm going to do a quick skin assessment. Here I'm looking for color, integrity, bruising, moisture, scars, bleeding, wounds. She didn't have any ostomies or fistulas, and integrity of any dressings if she had any. And I'm inspecting the toenails and fingernails for texture and color. Now we're going to test your muscle strength a little bit, okay? So first I'm going to have you straight against mine. All right, good. And Can you turn your head? All right. Okay. Are you able to?
Oh, grip.
Grip my fingers. All right, good. Then I'm going to check your feet. Can you push like you're stepping on the gas? Okay. And then pull against. Perfect. During this assessment, I inspected the extremities and joints for the deformity of limbs, hands, and feet. I'm going to have you stand up and I'll check your spine out. Can you lean forward for me? Okay. Just check your spine. Okay, it's even. All right, thank you. Now we're going to check your, okay, now we're going to check your range of motion. Okay, can I start with your head? Around, back, front. Okay, good. Let's check your shoulders. Up and down, up, down, out, all around. Okay, perfect. I see your hands. Can you make a fist? All right, spread them out. Straight fingers. All the way back. All right. Spread. All right. All right, check your elbows. Okay, perfect. All right, let's, oh, almost forgot. All the way. Okay, good. And we're gonna check out your hips, okay?
Okay.
Up, out, okay, to the left. My balance is on everything back, okay, other leg.
Oh, I did that leg.
Oh, you did that one. Yep. Roll around, and go out. Get that leg, get that one, yeah, that one. All right, you. I've already assessed her back, okay. Now wash your toes. Look some, up. That's, all right, everything's okay. Okay, can I get you to walk to the window and back? All right, your gait looks perfect.
Thank you.
That completes my physical assessment video. I took my gloves off and disposed of them. I washed my hands and I left my patient in a comfortable position. She was able to go home. And I documented the procedure and everything that we've done during the physical assessment.